Do you think our nation is in trouble?
I believe that we are in spiritual turmoil, and I believe that everything else that we're facing societally, culturally, is as a result of our spiritual bankruptcy.
So what do you think the church can? So what do you think the church can do to help make a healthy nation again?
I believe that one of the key things that the church needs to do is to focus on sharing the gospel of Christ. I believe that as we share the gospel, as we take the Great Commission to the nations who are here within the borders of our country, that we need to be faithful in sharing the good news. We can deal with humanitarian efforts. We can do all kinds of things, governmental programs and so forth. But if we focus on those things, we really get away from what the church has been called to do. Now, historically, you know that there was in the early 20th century a division, and you've got a theological divide in which theological liberalism went the way of humanitarian aid, the social gospel basically, and the evangelical, what some called the fundamentals, dealt with the gospel, the spiritual side, with a divide. And what has happened in recent days is there have been some churches who have recognized that Jesus didn't make that kind of partition, that kind of division. But rather than focus on what the federal government can do, or the state government can do, or local municipality can do, we need to ask the question: what do we as a church, as individual local church families, need to do? And we need to be faithful in sharing the Word of God. We need to be faithful in living the Word of God. And we need to be faithful in intentionally teaching Christian worldview. That our bankers need to look at their work from a biblical worldview. That our nurses and doctors, do we have a healthcare problem? Sure, but it's not what the media tells us, because our healthcare problem is we only deal with the physical aspects and overlook the spiritual aspects that are part of. And if we would have Christians who are in the medical profession, I'm not saying they don't, but I'm saying if there would be a broader understanding that we don't have to partition off our lives and say, okay, here's my church life, and then here's my professional life. That's one of the biggest problems that we have within the church, and I think it's something that we have not communicated well. It's something we try to do at the University of Mobile through our Christian Worldview course that every student takes, but it's something that we want to ingrain in students, that it's not just preachers who live out the gospel. It's regardless of major, regardless of profession, it is about living the gospel and sharing the gospel. It's a both and.